As a future nurse, I have experienced many clinical settings in which the patient I was caring for has been in some sort of pain. As a provider, I like to think, how can I reduce this pain in ways other than just providing medication? I'm Brianna Aldrich, and for my evidence-based project, I'm researching how the effects of Reiki on pain. For my entire project, I put together a poster, which is shown here. I'm going to break apart each section and go over that in this presentation. A little bit of background before I begin is that pain is a very common experience that is expected after surgery. Medications are often given to reduce the pain that patients are feeling, but these medications can have unwanted side effects. Not only can they make the patient drowsy, but they can make the patient uncomfortable and can delay the healing process. Non-pharmacological methods such as Reiki are being utilized more and more in hospitals. Reiki is non-invasive and has no adverse effects on existing interventions. In America, more than 1,000 people use Reiki, and this is still growing every day. This led to my research question: in patients undergoing total knee replacement surgery, how does the use of Reiki, in addition to analgesics, affect pain perception within the first 3 postoperative days? To find articles that I used for this study, I searched CINAHL and PubMed for nursing journals published within the last 5 years. I removed all duplicates that came up, and I ended with 5 articles that matched my criteria. I then chose 2 of these articles to compare to determine the answer to my previous question. The articles I chose are these 2 here. Effects of Reiki on Pain, Anxiety, and Blood Pressure in Patients Undergoing Knee Replacement, a Pilot Study, written by Baldwin, Vitale, Brownell, Kryak, and Rand, and published in the Holistic Nursing Practice Journal in 2017. The second article is Reiki's Effect on Patients with Total Knee Arthroplasty, a Pilot Study. Authors Knott, Fazzini, and Mooney, written in the Nursing Journal in 2016. In the first study by Baldwin et al., the purpose of their study was to research how Reiki affected pain, stress, and anxiety during the first 3 days after having their knee replacement surgery. In this study, it was done in Abington, Pennsylvania, and there were 46 participants. These participants were divided into 3 groups, one being the Reiki group, one being the sham Reiki group, and one being the control group. The Reiki group had patients getting 3 or 4 sessions of Reiki determined based on their discharge date. These patients received Reiki sessions for 30 minutes, with their pain being assessed 5 minutes before and 5 minutes after, vitals being assessed 5 minutes before and 5 minutes after, and their anxiety level being assessed 5 minutes before and 5 minutes after. Pain was assessed on a 0 to 10 scale. Stress was assessed based on their verbalization and their vital signs, and then anxiety was expressed based on their verbalization, also on a 0 to 10 scale. The Reiki group had practitioners who placed their hands above the patient in controlled ways to send positive energy from their hands into the patient's body to promote healing. The sham Reiki group also ran the same way as the Reiki group. However, they were not certified practitioners performing the Reiki, and there was no specific method to where the hands were placed and how the treatment was done. The control group consisted of just quiet time with standard care. There was no Reiki done for any of these patients. We just promoted relaxation. So the study found that Reiki significantly decreased pain, blood pressure, stress, and anxiety levels. This study, however, did have limitations, including the small sample size, hard time getting measurements of heart rate due to irregular rhythms and irregular respirations. Obtaining saliva samples proved difficult for some, since the patients were NPO, or could have no food or drink by mouth before the surgery, so it was difficult for them to create saliva. And then there was a high degree of attrition from the quiet time group especially, but also the sham Reiki group slightly, because they knew they weren't getting that Reiki treatment, so therefore their results were slightly biased. The second study by Knott et al., The purpose of this study was to research how Reiki affects pain and the hospital experience itself within the first 3 post-operative days after having that knee surgery. So this group was done in Bryn Mawr, Pennsylvania. There were 43 participants. There were only 2 groups in this study, which consisted of the Reiki group and the control group. And then the Reiki group showed reduced pain. So the Reiki group had 4 sessions of only 20-minute Reiki therapy, and the control group had no therapy at all. Now the Reiki group also had music played through headphones to help them relax a little bit more. And again, like I said, this group was the only group to significantly reduce the pain. So their study also found that no matter what group that the patients were in, at least 55% of them were happy with their treatment. Now for these groups to compare their pain level, Reiki, the pain was assessed again before and after the treatment on a 0 to 10 scale, and then with the control group, pain was assessed every time the nurse would go in to give a pain medication that was requested by the patient. Their study also had limitations, including that the sessions were shorter than a typical Reiki session. So a typical session is about an hour long, and these sessions were only 20 minutes. So they weren't getting treatment that was as effective as it should have been. Some participants were unable to rate their pain. So after surgery, some patients are just really tired. Maybe they still have a little bit of anesthesia, so they aren't able to adequately verbalize to the nurse how they were feeling, making it difficult to assess their pain. There was inconsistent distribution of questionnaires at discharge in order to determine the satisfaction levels of the patient's hospital stay. Music therapy was used in combination of Reiki, meaning the Reiki itself could have been contributing to the pain decrease, but music also could have been a contributing factor, so the confounding variable makes it difficult to determine that it's simply Reiki itself that's decreasing the pain levels. And then the environmental stimuli was inconsistent, so every patient had a different experience. Some patients experienced maybe more alarms going off or more distress based on the environment than others. All in all, these studies both found that Reiki does improve pain, anxiety, and satisfaction with the hospital stay. More than half of the patients in any group did say that they were satisfied with their treatment. No adverse effects have been identified with Reiki. The Reiki group used less pain medications than any other group in either study, showing that Reiki is more effective in decreasing pain. However, more studies are needed because the sample sizes were so small. It's hard to generalize the results to different floors of the hospital or different hospitals themselves. And then Reiki sessions were short, and the environmental stimuli and distribution of questionnaires was inconsistent, which could have led to bias or differing results. My recommendation is that Reiki should be implemented into hospitals to minimize pain after surgery. Although those studies had small sample sizes, I think that Reiki, in addition to pain medications that are requested as needed, it proves to be effective in reducing pain and satisfaction and should be implemented in hospitals. Implications for clinical practice. So these studies need to be done on more floors and with bigger sample sizes in order to be generalized to more hospitals and a more diverse group of patients. The same practitioner level and consistent hand positions need to be encouraged for all treatments. Reiki is low cost, has no preparation, and it causes no discomfort for the patient. You're not physically touching them. It's not very expensive. So for these reasons, it should be implemented. It would be a great addition to the hospitals. Nurses must be motivated to get certified. In order to perform Reiki within a hospital setting, you need to be certified. And in order to make it more accessible for a more variety of patients, more nurses need to be certified, meaning that we need to encourage nurses to get that certification. And then Reiki, since being a non-pharmacological method that has proven to be somewhat effective in reducing pain, It decreases the risk for becoming addicted or abusing opiates and other analgesics, which is a growing issue throughout many communities today. So Reiki itself should be implemented in order to combat these issues. And here are my references.